Morning, everybody. Thank you for joining us. We're excited to be presenting to you today about our Homeless Management Information System, or HMIS, and more broadly, a presentation on, as you can read your screen, Data Matters: How Northern Colorado Uses Information to End Homelessness. So I am going to give a brief overview, sort of a big picture overview of what HMIS is, what this means. And then Rachel, who actually does this work, is going to do the majority of the presentation. And then Scott Rich, our other HMIS employee, who is our HMIS system administrator, will be joining us for the question and answer portion as a presenter as well. So as you can see on the screen, I'm going to start by talking about what is a continuum of care. So the context in which we are operating, in which we're talking right now is through the lens of what's known as a continuum of care. Historically, for the last 25 or so years, the federal government, and specifically the U.S. Department of Housing and Urban Development, which is the primary federal government entity that funds homelessness service agencies, the HUD stopped funding individual agencies about 25 or 30 years ago and opted instead to fund continuums of care. Continuums of care are planning entities, official planning entities that represent cities, regions, counties, states. Really just depends on the size of the area, the nature of the area. And those planning entities collectively respond to HUD's requests for applications on behalf of all of the entities that provide services to people experiencing homelessness within their territory. So instead of Homeward Alliance, for example, as an independent agency going to HUD and saying, can we have X dollars to do X program, the Continuum of Care collectively says, these are all of the services in our region. This is the big picture. This is what we're applying for funding for. And then we as a region are going to disperse it and then report back on regional outcomes as opposed to individual agency level outcomes. So in terms of Northern Colorado, it's a unique time when it comes to continuums of care. Prior to 2020, Northern Colorado was part of what is known as the Balance of State Continuum of Care. The Balance of State Continuum of Care exists in most states, and it's what it sounds like. It's that you have continuums that represent individual cities, individual counties, regions, and then there's typically a continuum of care that represents everyone else, and that's called the Balance of State Continuum of Care. So prior to 2020, Colorado had only 3 continuums of care. Denver, which is run by an agency called Metro Denver Homeless Initiative; Colorado Springs, Pikes Peak, that's the agency, and then the Balance of State. And so you can see the Balance of State is a pretty big area. And the formation of the individual continuums of care really occurred at a time when Larimer and Weld counties looked very different than they look today. This was mid-90s, and it was obviously much more rural. I think, for those of you who lived here in the mid-90s, I'm sure you can attest to that, in particular Weld County. And over the last 25 years, we've just seen significant population growth. Within the region, we've seen subsequent growth in the homeless population, sort of in proportion with that population growth. And then simultaneously, what we've seen is the agencies that serve people experiencing homelessness in Larimer and Weld counties coming together to form essentially a pseudo continuum of care, actually an official planning body that was a sort of subcommittee within the Balance of State Continuum of Care. But in a nutshell, what happened is over the course of about a decade, from 2010 through 2020, Northern Colorado created a lot of the processes that are required to form a continuum of care. We had active participation from dozens of agencies. We created a fairly robust coordinated entry system, which in a nutshell means that there is no wrong door, that people experiencing homelessness are assessed according to the same tool and placed on the same list so that people aren't prioritized differently based on which agency or service they happen to access within the region. So we formed a lot of these processes, and frankly probably would have become a continuum of care sooner, if not for the fact that it's just very rare for continuums of care to actually branch off. Historically speaking, and across the country, the trend is actually the opposite. Continuums of cares tend to merge. I believe this, I can't remember if it's Delaware or Maryland, but there's there's small states that have, more than a dozen continuums of care. And so the trend and at the urging, I think, of HUD has been to consolidate, more collaboration that all of these continuums of care ultimately could create silos. In our case, obviously circumstances were different, and so after several years of sort of planning and working with the other entities or with the other continuums of care in Colorado, at the start of 2020, the Northern Colorado Continuum of Care was officially recognized as its own continuum of care. And now in Colorado, there are 4 continuums of care. There's Denver, there's Colorado Springs, there's Northern Colorado, and there's the balance of state. And Northern Colorado, I didn't say this explicitly, but I sort of indicated it. Northern Colorado is Larimer and Weld counties. And so what this means is that now we have sort of local control of our own continuum of care, and the ability to locally apply for or respond to HUD requests for or HUD funding applications. And just really within that, the ability to control our own destiny as a region and provide more meaningful services to people experiencing homelessness, demonstrate the results of those services, and seek more funding based on the results of those services. Just a sort of brief kind of, this is the last part I'll touch on before I hand it off to Rachel. Continuums of care typically require 2 primary roles. Sometimes continuums of care are actually nonprofits or official entities that perform all the duties of a continuum of care. In our case, we have 2 primary entities that oversee 2 key functions within the care. We have a collaborative applicant. That's really the lead agency for our continuum of care. They are the ones who respond to the notice of funding availability that HUD puts out every year. They're really the ones who are responsible for making sure we're in compliance with our grant applications, that we're aligning with best practices, that we're developing the programs that we need to in order to qualify for HUD funding. And in our region, that's United Way of Weld County. The other significant role is the HMIS, Homeless Management Information System, or Data Lead Agency. So HMIS is the data, and Rachel's going to obviously go into this a lot more, but HMIS is the data tool that, or the data system, or it's actually a set of data standards that HUD requires us to collect, and then we have an actual data system with those standards built into it. And excuse me. The very unique thing that I want to touch on is that Colorado, while it has 4 continuums of care and therefore 4 entities that serve in this HMIS lead agency role, overseeing the data systems for all of the HUD-funded agencies within their territory, the system in Colorado is statewide, so it is all connected. We have local control over the Northern Colorado programs, but the system is Colorado HMIS. And so if someone seeks services in Denver at an agency that is in HMIS and signs a release of information and then comes to Fort Collins, they are already in the system because it is shared. So I think that's a very unique feature of this system that I just wanted to touch on before I passed it off to Rachel. Just broadly speaking, I will end by saying this is a really exciting time for Northern Colorado when it comes to the possibilities for homeless services and potential funding for those services. We have already seen in 2020 the enormous benefits of having our own continuum of care. Literally millions of dollars in federal and state relief funding passed through our continuum of care this past year. And the ability to deploy that rapidly with maximal impact was exponentially greater in 2020 than it would have been in 2019, if not for that local control. So with that, I'm going to pass it off to Rachel. And just thank you again for joining us today.
Thanks, David. All right, so what is HMIS? And I know David touched on this a little bit, but I'm going to go a little bit more in depth. But HMIS is a homeless management information system. It's a local information technology system used to collect client level data and data on the provision of housing and services to people who face homelessness. The system can show us the characteristics and service needs of individuals and families experiencing homelessness, as well as the services provided to them by agencies across the community. And as David mentioned, this is we're in the state's instance, and so it's very unique. We can see services provided to people across the state, not just our community. And so HMIS is the HUD mandate. It's a set of data standards that agencies are required to collect and report on. And then the COCs contract with different vendors to identify a system where they can input the data. The state of Colorado, as we mentioned, utilizes the same platform across all continuums in the same instance. In addition to the shared information, it also opens up more opportunities for collaboration and support across communities between those HMIS lead agencies. And while Northern Colorado chooses to use the same platform across the state, yeah, it's ultimately the lead agency's decision to choose the platform. And so in 2018, Homeward Alliance actually received the innovation grant from United Way. This was before we were a Continuum of Care, before we were inputting into HMIS. We received this grant from United Way that allowed us to purchase the software, the Clarity software that the state uses. And we did this intentionally to position and prepare ourselves for the lead agency, or the lead data agency role when NoCO became its own COC. And David, if you want to elaborate on that at all.
Yeah, I'll just briefly elaborate on that by saying that the state of Colorado, all of the continuums, which did not include Northern Colorado Continuum of Care at the time, but included several representatives from Northern Colorado. They were looking for a new data system for HMIS. For those of you who are service providers and have been entering into HMIS for years, you know about this transition that the state of Colorado opted to switch vendors and go with a new system known as Clarity Human Services, as Rachel mentioned. We knew that was the system that the state was moving towards. And so as an agency, we decided to adopt that system and build our own version of it so we could learn the data system before we officially became our own COC, before that transition actually happened, so that when it did, we were ready to assume the role of lead agency, of HMIS lead agency. And so that was made possible, as Rachel mentioned, through a grant by United Way. You're welcome for the shout out. That allowed us to, I mean, it's an expensive data system for an individual agency to have. And so especially at that time in our growth. And so it really allowed us to learn this system and positioned us to take over the lead agency role. And the other thing I'll emphasize there, just because I think you'll probably hear me do a few sort of pitches for this system, and Rachel too, is that this is not the system that you worked on 10 years ago if you were entering data into HMIS. This is a data system that is built for human services with HMIS customizations built into it. It is first and foremost about human services. That's not to say the system isn't fully HMIS compliant. It is, but it is a tool that we would use regardless of whether we had to, and we have been using, not having to use it for several years now.
Thanks, David. And yes, just to clarify, we're the lead data agency, the HMIS lead agency. And so what that means for Homeward Alliance is that we are responsible for overseeing the system's standards and privacy requirements for any agency that receives federal and/or state funding. We're responsible for HUD and other funder required reporting, and we also are responsible for helping agencies gain access to the system by building out their programs in Clarity and providing them with ongoing support and training to the end users. And then in November of 2020, Homeward Alliance as an agency actually migrated their data into HMIS. So what are the client benefits of HMIS? Because HMIS is a shared platform, clients who access services from one agency and then go on to services at a second agency will not have to complete another intake. I think David touched on this when he mentioned how we share across the state. We can see individuals who are accessing services in Denver or Colorado Springs all the way to Fort Collins. And so this improves the client experience by reducing the traumatization of having to repeatedly tell their story. Referrals also become more streamlined through the system. Agencies can make referrals to other programs within the system, and service providers will know the result of their referral. They can also see what referrals have already been made for a client. Improve coordination of care and protection and confidentiality of personal information. HMIS has a very robust set of security features that are built into the platform. And what are the community benefits of HMIS? Well, first, it improves our ability to show where we stand as a community. Our data becomes cleaner and all-encompassing. We can better see causes, trends, and future needs of homelessness. And it allows leadership in our community to make better informed decisions on system design and policy. It also increases our opportunities for federal funding. As David mentioned, millions of dollars have already come through to Northern Colorado in response to COVID. And I think a big portion of that is thanks to the fact that we did become our own continuum of care and we were set up to receive that. So we know what funding to go after and we're prepared to apply for it, receive, and implement that funding. And finally, it allows us to expand upon existing housing resources. So our resources will grow, we become faster to responding to the needs of people experiencing homelessness, and we end chronic homelessness. As of 2021, the agencies that you see here are participating in HMIS in Northern Colorado. I do think it's important to note that there are agencies, there's a lot of agencies on this screen that you see that were inputting HMIS data long before Northern Colorado became its own continuum of care. However, that data was being inputted into the balance of states system. And now that we've formed our own continuum of care, we can put that into Northern Colorado's system, and it actually gives us an accurate representation of what we're seeing in our community, rather than having it all be filtered into the balance of state and be compiled with data across so many different counties. We can't thank these agencies enough for their hard work and the services they provide to people experiencing homelessness. And then on top of that, they're collecting a robust set of meaningful data to contribute to the continuum's data. So thank you so much to the agencies who are participating. And what's next for us and our goals as the HMIS Lead Agency? So first, we have coordinated entry coming on board. Northern Colorado, as David mentioned, has been maintaining a coordinated entry system for, I believe, maybe the past 4 to 5 years now. It's managed by Summer Garcia with United Way. It's a process developed to ensure that all people who face homelessness have fair and equal access and are quickly identified, assessed for, referred, and connected to housing assistance based on their strengths and needs. Communities are responsible for selecting an assessment tool in Northern Colorado, that's the VI SPDAT. But the integration of coordinated entry into HMIS will increase our ability to catch individuals at an early stage and funnel them into the appropriate housing program. We're also in the process of onboarding new agencies. So specifically, we're highlighting a few agencies here that we're currently in the process of getting into HMIS. I'd like to highlight this Outreach Fort Collins is going to be the first street outreach program that we have in Northern Colorado's HMIS system. And we estimate implementation takes about 3 to 6 months, depending on the size of the agency. So we provide intensive support in the beginning stages just to ensure that Clarity is meeting the data collection needs of their agency, as well as that their end users have a thorough understanding of how to use the system. And our future goals will continue to be to onboarding agencies until we have all homeless service providers inputting into HMIS. So whether you're a community member, a partner agency, or someone who provides services to people who face homelessness, we hope you have a better understanding of HMIS, the recent formation of the Northern Colorado Continuum of Care, and what Homeward Alliance responsibilities are as the lead HMIS agency. And now, if anyone has any questions for us, we will happily take those in the chat, but we do ask that you please stay muted.
Rachel, you want to unshare that screen so I can spotlight you and Scott and me? Fine, Scott. Does anybody have any questions to start us off? And you can feel free to unmute yourself.
David, Scott Elder, question is it interesting enough to give a demo of the data? I know that we have confidential issues, but just to show what's there, maybe what you didn't have in the past, how people can take advantage of the combined information.
I think it just doesn't let me spotlight. It doesn't let me spotlight you, Scott. So you're just going to have to unmute and speak. Sorry.
Oh, okay. I'm here. Sorry about that.
No, that's okay. Scott is our HMIS system administrator and has about more than 2 decades of experience doing HMIS implementations across the country, including a couple of statewide implementations, and definitely an expert on this. So go ahead, Scott. Do you want to take that one?
I think the question was, could you have a demo of the product? Is that the question?
Yeah, I think basically what's worth, yeah, is it interesting enough to show us something was the question.
Well, I'm a data guy, so of course it's interesting enough. I would suggest that maybe we just schedule a half-hour demonstration in a week or so, and Rachel or I could walk you through it, and you could ask questions. Sure.
Yeah, it would be a little difficult to do it in this sort of forum. It would take a little longer to explain, but maybe Rachel, Scott, I'm looking at the questions coming in. So let me just read a couple of questions to you all that are coming in. So one question is, how many and which agencies are in the pipeline for HMIS?
Do you want that one, Rachel, or do you want me to?
Sure, yeah, and Scott, you can elaborate if I miss anything, but right now, Allison, we're in the process of getting coordinated entry into the system, so that's in process. And then the other 3 agencies that are in the pipeline right now are Family Housing Network, Outreach Fort Collins, and Jobs of Hope, which is a Greeley agency. And those are agencies that we're working with right now. We're in the process of getting them all set up in the system.
And what's the current number in Northern Colorado of agencies? Sorry, did you say that?
I believe it's about 10 agencies. Homeward Alliance is the most recent to onboard into HMIS with over 2,000 clients.
Yes. Yeah, and for us, that's more than 10 different programs that we onboarded. So while it's just one agency, it was and there are a couple of agencies that have multiple programs. So 10 might not seem like a big number, but it's a lot of clients, a lot of individual human beings who are in that data. I believe that's Lisa who asked, I'm wondering how, or maybe not, I'm wondering how cleansed data that is collected in HMIS can be accessed by the public. I'll just say really briefly here that one of the things that we're going to be developing this year is a data dashboard that will be a Continuum of Care wide data dashboard, so the public will have something to access. I would encourage people to, if you just Google, homelessness data dashboards. Kansas City, Missouri has a great homelessness dashboard, and they actually have some recent updates related to COVID, and they have updates related to racial disparities. And so if you look up Kansas City Coalition to End Homelessness data dashboard, you can see kind of the vision of where we're headed with the kind of data we'll be able to present. But big long-term trends, but with the ability to sort of dig into the data. We're also working with we'll also be providing quarterly a quarterly data point to the city of Fort Collins that will be included on their community. I apologize, I can't think of what it's called. Beth, I know Beth's on the call, so feel free to correct me if I'm wrong on any of this, but the City of Fort Collins community data dashboard will be contributing the homelessness metric to that, which will likely be just entries into homelessness and exits out of homelessness on a quarterly basis. Do you want to add anything to what I said? Sorry, I guess I said more than I meant to say. Rachel, Scott.
Yeah, I'll jump in.
Sure.
I'll talk about it on the security side. I think it's great to have data and to release it, but it's really important that as the data is released, there's procedures in place and that there's confidentiality of the clients that are taken into consideration. So we as a continuum have our own set of our own policy and our procedure to release data so that it's not anyone in the community, anyone in the HMIS can't just release reports and things to the community without some proper guidance. And then on a state level, we're part of the four continuous, each have a representative on a data security team. We kind of go through at a state level the policies and procedures for releasing data. There's an old saying, the devil's in the data. And when data is released, if it's not released properly and really qualified for what you're trying to find, you can run into problems. So I love having data go out into the community. I think it's very, very good. And at the same time, I like to just be really careful with that. So that's all.
So next, Rachel, do you want to give anything to add, Rachel? Okay. Can the data from the HMIS system be disaggregated to the county, city, or organizational scales? And that's actually, I think that's a simple yes, it can be.
Yes, so each agency has their own set of data that they can pull. So if you're an agency in HMIS, there are reports that you can pull as an agency on just your agency's data, but then we can also pull data by region as well. So if we wanted to pull data on the entire continuum, we could, of just Northern Colorado, or if we wanted to do just Larimer County, we could, or if we wanted to reflect data on the entire state of Colorado, we can do that as well.
How do member agencies coordinate services for individual clients using this system? Or do member agencies just put information services, into the system and others read it? So I can speak a little bit about our agency, specifically how we use the data system to coordinate services for individual clients. And then Rachel, you can speak more, Rachel or Scott, you can speak more broadly, but for us, all of our programs are in this system, so it can be used for direct referrals to programs. It can be used for a case manager who's working with an individual to see exactly what services that person has accessed within, or exactly what other programs within our organization, with exactly what services the person has accessed at the Murphy Center. So it allows us to, basically it allows us to follow up. That's a big piece of it with any of the agencies that are actually in the system. We can see if they, if we made a referral to our employment program or our housing case management program, we can see sort of the follow through on that. We can track, we can issue alerts. So in the case of, in COVID, it's been the tool that we've used to find people who have tested positive for COVID or who have a suspected exposure to COVID. And so all of this information is of course extremely protected and is only shared if the client has signed a release of information, or if it's a public health or a danger. But those are just some of the ways that we use it. I know some different possibilities of ways communities use it. As different communities use it. I mean, you could check in at a place like the Murphy Center and reserve a bed and for that at the shelter that night, for example. What Rachel had mentioned, that we're building out our coordinated entry system into HMIS. What that means is that anyone who is assessed across Northern Colorado, according to this common assessment tool that most agencies, all COC agencies use to assess vulnerability, all of that information will be in HMIS, which means we'll have a by name list everyone experiencing homelessness in Larimer and Weld County with their, sort of with this score, their score on this vulnerability assessment. And that makes referrals to the appropriate programs just far simpler. Referral to housing programs far simpler.
Yeah, I could add to that. When data is collected, part of the question is, did the providers see the services? Basically, there's a client file, and that consists, the main part is a client profile. And that's basically the name, social security number, race, gender, ethnicity, just basic ID or information there. And then each agency, at this point, we have security based on each agency. So whenever they enroll in the program, there's a lot more information entered. And that data is restricted to their own agency. So United Way could not see Homeward Alliance program level data, which might include disabilities, DV questions, HIPAA questions, things like that. So there's a very good visibility and sharing of data model in Clarity, and it makes it very easy to do. Once we implement the coordinated entry, most communities usually start adding some of the visibility to the implementation. For instance, if someone comes in on coordinated entry, that coordinated entry assessment would probably be viewed by all of the agency and users that are actually active in coordinated entry. So as we roll this out, there'll be some discussions on how data can be shared and visible. For instance, if they came into the Homeward Alliance and they had several services, if it's set up to share data, which again, it's not now, but if it was visibility wise, they could go to the United Way and you could look at that client's history and see that they've had all the different services over at Homeward Alliance and various things. So some nice sharing and visibility features there. But I wanted to stress now that that's not the case. Each agency has their own security and all set up within their own agency. So I hope that wasn't a clumsy answer, but that was it.
I want to give a shout out to Summer Garcia, who works at United Way of Weld County. And you don't have to say anything, Summer, but Summer is Summer has been coordinating our. I'm going to use coordinated twice. She's coordinating our coordinated our CAP system, coordinated assessment and housing placement system. These are, excuse me, this is our by name lists. Actually, it's four by name lists, I believe: youth, veterans, adults, and families. Is that right? Did I get them wrong?
And youth.
Thank you. Thank you. Excuse me. Summer has been maintaining by name lists of individuals who are experiencing homelessness across Larimer and Weld counties, and coordinating those weekly case conferencing meetings with dozens of agencies across both counties who are working with those specific populations. And so our hope is to make Summer's job less manual labor, because she's been doing this in Excel for a long time, and give her and United Way as the collaborative applicant the ability to focus on bigger picture stuff and not have to worry about the data to the extent that they are right now. So it's been a big lift for them, for Summer in particular, for the last couple of years. So just wanted to note that, because we're kind of, I don't want it to seem like we're taking credit for coordinated entry. It's just building it into HMIS is our role.
Yeah, I'd second and third that. Summer has become my data hero and my mentor. I've implemented several coordinated entry systems, and this is probably the most organized community I've worked in, as far as having it put together and the process in place before the software is implemented. So I'm really excited to implement this with y'all. It's really good.
There was a question about On the slide where the client benefits, it stated that talking about unduplicated intakes as one of the benefits, and this is Larry asking, how does the intake packet question, how do our intake packet questions like the HMIS intake differ from specific service data collection or intakes with programs that we have, like our hand up program or peer navigation? So that's a good question. Larry, tell me if I'm not expanding, tell me if I'm incorrect in trying to expand this a little broader. We have agencies that have their own intakes and programs that have their own intakes beyond just what HMIS requires. And so what's the difference? Is that basically the question?
Yeah, that's pretty much it, David. I'm wondering about if unduplicated data at intake is, how are we protecting, or no, how are we making sure that we don't have duplicate questions from the intake for the initial contact? I'm thinking like resource navigators at Murphy Center versus, like, for me, peer navigation in the intake packet that I have to complete with people participating in my program, making sure that there's not duplication of the questions there, so we don't have, you see where I'm going with that?
Yeah, good question. Yeah.
Yeah,
good
so
question.
I guess if you are looking at two enrollments and one maybe has a little bit of different questions than the other, basically there's a HUD standard form, and that's probably, like, Larry, for what you know, like that's what the Murphy Center intake looks like. That's what a lot of the programs in HMIS, no matter what agency you're in, you're using just the HUD standard intake form. And those questions are actually, if you have the same set of questions from program to program, that data will actually cascade into your enrollment. So if you do have the same questions, they will actually cascade into your enrollment. So you don't actually have to ask them again if you are looking up a client and wanting to enroll them in your program before you have that conversation with your client about enrolling them. If you look them up in the system, you'll see that that data will cascade into your program's enrollment if they are the same questions. Now, some programs and some agencies have additional data points that they need to collect just because they have specific grants or funders who want to know very specific things that are not included in that HUD standard of data collection. And so some programs might have additional questions that are not similar across the board. And so actually the similarity is what prevents the re-asking of questions to the clients, because that data is already in the system.
Glad you asked that. I didn't know that. That's a really nice feature. So I guess working with for new agencies or programs that aren't in the system, it would be making sure that the questions that can match do match exactly, so that they cascade, and that the only ones that are different are the ones that truly are different. Taylor McDonald asks, is there a way to mass enroll existing HMIS clients into an agency's program? I don't know the answer to that.
Scott, you got to answer this one.
Well, if I understand mass enroll, no. The software is client specific, and so HMIS and Clarity, at this point, we don't have an upload feature, meaning I can't take an Excel spreadsheet and upload all of that into the system. There are several reasons for that. I know that at the state level, they're working with the VA and various people for some of the veterans data to be uploaded. But in general, no, I call it a big pizza party. If you have a bunch of people to enter, you sit around and eat pizza, and 5 people on computers, and you just get it entered in. I don't know if that answers your question, but.
There was, oh, sorry, I missed a question. There was as a NoCO citizen, how can we best support your efforts? I apologize, I skipped over that question. I think, well, I'll say we really want, this system works best when as many programs and agencies that serve people experiencing homelessness are on it. And so if you are even if you're a citizen, if you are on a board or you're supportive of an agency that's not, you know, currently utilizing this system, but you think maybe they should be, I think spreading the word about the fact that we really are making a concerted effort to coordinate data collection across our region. You know, it's just it's spreading the word is almost always the best thing that people can do to help with something like this, especially. I mean, of course, financial contributions, because there's staffing and license fees associated with this. But you know, in our this year funding is a little quirky for 2021 because it's a little bit technical, but basically HUD decided that they were just going to renew the COC contracts from the prior year rather than issuing a new what's a NOFA, notice of funding availability. And so as a result of that, we are kind of uniquely we're uniquely screwed by that because we, as the HMIS lead agency, because we've never responded to a HUD NOFA as a continuum of care and asked for funding for HMIS, and that's kind of how a lot of HMIS lead agencies are funded. Now, having said that, there's COVID relief dollars that have funded our some of our growth, and I'm not concerned about the long-term sustainability of our HMIS team. I think license fees are going to be an issue as we try to onboard more agencies, and we really want this to be free. We want it to be we want it to be incentivized. I mean, we want it to be attractive to people to participate in this. And then I think just expanding beyond that, awareness about the continuum of care as a whole, because HMIS is just the data piece of the bigger picture that is trying to coordinate our regional homelessness, our region's homelessness response system. So while I might not be concerned about the sustainability of our HMIS lead agency activities, I do want to make sure that we have adequate resources to support the programming that's happening at the continuum of care level. And there is nowhere near enough funding to do the work that we know needs to be done to make homelessness rare, short-lived, and non-recurring in our community. If you are someone who has expertise in data, there may be volunteer opportunities or opportunities to actually get involved directly with some of our work. If you are Scott had mentioned data entry. That would be probably the most likely volunteer opportunity, although there are some pretty strict rules around who can enter data into HMIS. Just volunteering more broadly and contributing more broadly to these to us and other organizations within our continuum. HMIS and this data system is a vehicle through which we collect data and analyze the work we're doing, but the work we're doing is the piece that I think citizens have the opportunity to advocate for and support most directly, either through volunteerism or donations or advocacy. But Scott, Rachel, do you want to add to that?
Yeah, I'm not sure, David, if you covered this. One thing I've seen in communities is educating the citizens. When I say that, as we roll out the coordinated entry, if people in the community, the businesses and areas where the homeless people congregate, if they have a way to direct them to one of the shelters or the coordinated entry, so help them get into the system so that we can better take care of them is I think important. I also wanted to correct myself on the uploading data. If you have lots of data, like Homeward Alliance did, there are ways of having conversions done. So you take your data and it's converted and uploaded, but it can be expensive and such. So I'll correct myself on
that. There's a question from, Taylor asked, after the mass enroll, is anyone in the pipeline to use HMIS cards that Catholic Charities is working on this currently? So this is, I believe what you're talking about, having swipe cards at intake. Is that right, Taylor? That kind of thing? I assume that's what you mean. Yeah. Okay. Thanks. Rachel, are you equipped to give an update on that, or do you want me to? I don't know if you've spoken to them. Have you spoken to them?
No, we haven't spoken,
Okay,
yes,
then-
but I
then-
guess
then-
we could
then-
say that it is.
I can say that we've been in this discussion with Transport and the City of Fort Collins for like a year and a half, a couple of years now. It started with a lot of different agencies at the table, and the Transport has been ready to go. The city's been ready to go with this for a while. We've just been waiting for Homeward Alliance to migrate its data system into the statewide HMIS system. Which, it's the same data platform, but migrating our data into the statewide instance of that same data system. And now that that has happened, we can actually move forward with the swipe cards. And so the current vision is that the Murphy Center will issue swipe cards to people who want them, to people who want them. And just based on other communities, most people do want swipe cards. And actually, a common question is do people hold on to swipe cards? How often do you have to, reprint them? And yes, people do lose swipe cards from time to time, but it's not a significant cost, and it's not a significant number. And these are typically photo IDs, so they're not forgeable. And so the working plan is to have a swipe card that allows folks to check in at this is specific to Larimer County. I should note that people use the swipe card to check in at the Murphy Center, and it'll also be a bus pass, a Transport bus pass. So that's the working plan, and I think it'll happen. It's hard to say a timeline. Scott, Rachel, Linda, I don't know if you want to take a guess, but I would say the first half of this year.
Yeah, I would hope the first quarter. I'm sorry, Linda. Was it?
First quarter? Okay, that's a bit. Yeah.
I'm an optimist, though.
All right, optimistic. I like it. And so, in terms of if there are other agencies that are interested, and just again, if there are agencies that are interested in this, just in general, please reach out to. You can private message Pam during this, or me, or Rachel, or email us.
Yeah, we're also, David, we're also working with Catholic Charities and a few others that it doesn't necessarily have to rely on the bus pass. That's a great
Gotcha.
opportunity.
Okay. There was a question from Allison Haid in Loveland. What is the additional cost for the bus pass edition? Wondering for Loveland. I don't have a number to be able to give you. I don't want to guess. It's not massive though. The cost is to the city of, Linda's telling me there is no cost. Is that it might be because Transport's picking up that cost. But I think the cost is the donation of the rides, sort of an in-kind donation of the rides. Nick from Outreach Fort Collins asked, do swipe cards have mobile check-in capabilities?
Yes, you can use any device as long as you can log into Clarity. At this point, you have to be able to log into Clarity, and then you can swipe it. So if you have an iPad or something like that, you could certainly use that.
Allison, I know we were going to meet anyway, so we'll talk about that when we meet. Let me make sure. Sorry, I'm just looking through to make sure I didn't miss any questions. I don't think I missed any questions. If I missed any questions, please speak. All right. Well, seeing no other questions, I suppose Scott, Rachel. At one point there was talk about integrating HMIS data with CDP HE COVID tracking, Colorado Department of Public Health and Environment COVID tracking. Yeah, is there any update with that? Because those conversations were happening at the statewide collaborative level.
Yeah, we're still working on it to make sure that it's consistent across the state. But yeah, that's in the works.
Okay. Do we have a timeline on that? Do you know?
I do not.
You're going to say 2 weeks because you're really optimistic.
No, not when I'm working with the state. That's
right. Yeah, that one is a little. We're not as in control of our destiny on that one.
So, yeah, and it's a little more complex than it might seem because you're coordinating 4 different continuums to track real specific data and have it consistent across the state. Is it's not a simple thing. So
Yeah, thanks for bringing that up though. That is a good question. And some of the best data dashboards, like why I mentioned the Kansas City one earlier, has such good information on COVID specifically, and really breaks it down so you can see the disparity of cases among the population of people experiencing homelessness, and then within that, the disparities among people of color, the LGBTQ community, basically every marginalized population, further marginalized. It's sad, but it's important to have that data. Yeah, you're not gonna get very far in policy discussions or trying to, get legislators to move on meaningful new things if we can't prove there's even a problem. And so that's I think a big part of what HMIS is meant to help us with, is sort of demonstrate the extent of the problem, but also demonstrate the extent to which we are solving it. Before we close, I guess I'll just give one last chance for questions, and I don't know if Rachel or Scott, if you have anything you want to add that wasn't addressed.
no, I'm fine. Thank you.
Yeah, just thanks everyone again for attending. And if you are an agency that's interested in participating, feel free to reach out to either Scott or myself.
And do we have HMIS at home? Is that an email, HMIS@homewardalliance.org?
We do, yes.
So does that go to you and Scott?
It does, yes. It also talks to we have a Zendesk ticket platform. And so I could post the link to that website in the chat, but you can submit tickets. It's a help desk ticket platform. And you can submit tickets there, whether you're an agency participating or not. So if you are a non-participating agency and you want to get in touch with us, Zendesk is also a very effective way to do that.
I just typed their email addresses into the chat. We will post this, the recording of this, and share the link with those of you who we have emails for. We have a list of participants, so please feel free to reach out to us if you have anything else. Yeah, thank you everybody so much for joining us today. It was a pleasure to host you, and really appreciate all your questions and involvement in the work that so many of you do on a day-to-day basis. Everybody has a great day.
Thank you.
Thank you.